This is KTVO's Good Morning Heartland.
Well, November is National Pet Diabetes Awareness Month, and for many of us, like myself, I did not know that that could be possible. So we have Dr. Catherine Webb from the Lindquist Veterinary Clinic in Kirksville here this morning to talk more about diabetes in our pets. How are you doing?
Doing well.
Yeah, so I was really surprised because I did not know that pets could get diabetes.
Absolutely. And just as we have an epidemic with obesity in people in our country, we also have quite a bit of obesity in pets. In fact, I see more and more pets all the time that have larger and larger body condition scores. And just like obesity is one of those risk factors for people for developing diabetes, it is in small animals as well.
Okay, so what are some symptoms? I understand there's some symptoms that these animals could show if they do have diabetes or signs of diabetes.
Absolutely. Pets that are drinking an awful lot and urinating a lot more, pets that have sudden weight loss, and in some animals, like we see it more in cats, there are orthopedic problems that can develop with diabetes. So they start to walk differently. Instead of being up on their toes, they are down flat on their feet. So we call that a diabetic neuropathy, which can happen in people as well, only it's a different presentation than cats.
Right. So if our animal is experiencing or showing some of these symptoms, and obviously some of these symptoms fall in different categories too, and we take them to the vet, is there some sort of test you guys run, or how do they become diagnosed?
There are lots of tests. We do test pets' blood sugar,
Okay.
and there are fructosamine tests where we can test the body's response to blood sugar over a 2-week period. Your veterinarian may recommend a CBC and a chemistry to see if there are any other organs that are having problems. We can diagnose some of these problems and have a lot better prognosis for pets, so a lot greater chance that they will do better for longer and require less insulin if we do survey work for them. And what I mean by that is when you go in for your well pet checkup for your veterinarian, you say, hey, what about running some blood work and checking to see how Fluffy is doing, or Kitty, how they're doing?
Right.
So survey blood work. Prevention is always the best medicine, especially for cats. There are some cats that if we start at an early enough time in the disease process, perhaps before even owners know there's something wrong, we can catch that problem, make a diet change, and sometimes make a pill change. So sometimes we can control diabetes in some animals with oral or medicine we can take by mouth. But for the most part, especially with dogs, injectable insulin is what we use when they're diabetic.
And is that something that we can do, or we have to go to the vet for them to inject?
Just like with people who need that daily, twice daily, pets need it at a regular time as well. And so that's something that in working with your veterinarian, you can become comfortable, hopefully, with treating your own pet with injections. And as always, I always caution folks that there's a lot of misinformation around online you can find. You can find websites that tell you that you can cure a pet with this diet or that. And if we're talking about a dog, the only thing for a dog is going to be injectable insulin. Otherwise, you're going to lose that pet to that disease.
Okay, and if you are uncertain, the best thing to do is obviously contact your veterinarian and get
Absolutely.
information. Well, thank you so much for your time. I
You're
appreciate
welcome.
it. We'll post everything on our website at heartlandconnection.com. We'll be right back.